Hi, my name is Tim Swindell with Mid-South Medicare Advisors. I am so sorry, planned on being in person with you guys tonight, but circumstances did not allow that. But I do want to take this few minutes to see if we can answer some questions for you concerning Medicare and Medicaid. So let's get started here. First of all, again, Mid-South Medicare Advisors, we do education, consulting, and enrollment. There's our website and also the phone number. I will review that at the end. One philosophy we have for our business, we borrowed from C.S. Lewis. It's not your business to succeed, but to do right. When you have done so, the rest lies with God. So let's start into Medicare first. Who is eligible? Well, you need to be a United States citizen or legal resident for at least 5 consecutive years and one of these. Age 65 or older, you can be younger than 65 with a qualifying disability, or you can any age with end-stage renal disease or ALS. Big question, when do you need Medicare? Medicare Parts A and B. Well, you don't need it until you use Medicare for your health insurance. It's quite that simple. The number one confusion that I deal with is if you don't sign up for Medicare at age 65, you are going to get a penalty. And that is simply not true if you continue to work and you keep your creditable group insurance coverage. That's what keeps you from any penalty is working past 65, having that group insurance without a 63-day gap. How do I sign up? Two ways, Medicare.gov, very easy, very simple. The other, which I would recommend, is the local Social Security office. The only reason there, if there happens to be an issue, a complication, it's much easier to get a hold of someone locally than it is through the website as you're going to Atlanta or Chicago. So, what are my Medicare coverage options? Well, it's quite an alphabet soup. Let's talk about this, see if we can put them in separate boxes. First of all, your Medicare card, your red, white, and blue Medicare card has Part A, which is the hospital, and Part B, which is everything else, doctors, emergency room, all of those things. That is your Medicare card, red, white, and blue card. Once that cornerstone is established, then you choose one of two roads. The first is called Part C or Medicare Advantage, and this really relates to the same coverage you've had in group. One card, doctor, hospital, medical prescription all together there. The other road you can go down is combining a Part D prescription drug plan with a Medicare supplement, which comes in different plans. So let's see if we can break this down. Again, the cornerstone, the base is the Medicare card, your Medicare Part A, Part B. Now, Part A normally does not have a premium as long as you've worked and contributed to Social Security for 40 quarters, 10 years. Medicare Part B will have a monthly premium based on your adjusted gross income 2 years prior to the year that you apply. And this year, the base premium from which most folks hit is $185. Now, what is not covered? We need to know that with Medicare, they do not cover nursing home or long-term care. Also, your medical, non-medical vision, hearing, and dental, like your group insurance, is not covered. You need another plan for that. And then your prescription drug coverage. If you think back, that is just medical coverage, no prescription coverage. So you could use this for your medical. If you would, then you've got a great financial responsibility, and I would never recommend this. If you go into hospital, your deductible is $1,676 each time. Part B, the other parts of this, you pay a one-time annual $257 deductible. Then you pay 20% of the Medicare approved cost, but there's no out-of-pocket maximum. So it could be a financial black hole if you only had this. So how do we supplement that, if you will? Now, Medicare Advantage plan is not a Medicare supplement, but let's talk about these two roads that you can go down to get that additional coverage. With Medicare Advantage, the Part C, you do have to have Part A and B and live in the planned service area. This is a private insurance coverage that combines Part A and Part B. It is under the oversight of CMS Medicare. Most of these plans do include prescription drug coverage, and most of these plans will include those vision, dental, hearing benefits that are not normally covered by Medicare. The Part C Medicare Advantage plans will add those in. So with the Part C, again, I've said they're offered by private insurance company, and those additional benefits are included in there. Things can change from year to year. And I will tell you with a Medicare Advantage plan, normally the plan premium will be zero, zero. You do have the one card like your group with medical and prescription on the same card. You have a network of doctors and hospitals that you need to utilize. And there's a general service area for you to be in network. Now, if you're traveling, any emergency is covered as in network, and most of these plans, urgent care would also be covered. So that is the Medicare Advantage Part C. And again, I would correlate this to the group insurance that you're normally used to. The other road that you can go down is the Medicare Supplement and Prescription Drug Plan. Now, in this option, let's take the medical side first. If you had a medical service, the doctor would present your Medicare for a claim, and if Medicare pays, then the Medicare supplement would pay. It supplements your Medicare card. With a Medicare supplement, you must medically qualify except your first time into Medicare, and it's guarantee issued, no questions asked. The big advantage here, largest network available, literally any doctor, hospital nationwide that accepts Medicare. Great for folks that are traveling, great for folks that may have that rare disease where there's only a few specialists nationwide that you can get to. Now, benefits are paid only if Medicare covers the service. I said Medicare gets the claim first. If they say, yes, it's a covered service, that we cover it, then the Medicare supplement pays their part of it. These are offered by private insurance companies also. Now, with the Medicare supplement, they come in plans A to N. I will tell you the most popular plans are Plan G, which if you're taking care of older parents, they may have a Plan F, which is the predecessor to the Plan G, or the Plan N. So those are the two most popular at this point. The government is the architect of these plans, and let's just take a Plan G. They say, a company, if you sell Plan G, this is what you're selling. So every company out there is selling the same plan. There are no differences. This does help to cover some of what Part A and B don't, those deductibles and co-insurance amounts we talked about earlier. And of course, the more comprehensive the coverage, you can just rely on that premium being higher. There will be a premium associated with this. Yeah, most 65-year-old males, you're probably looking somewhere for a Plan G, somewhere between 130 and 150 a month for that Plan G. Now, if you happen to be looking at Massachusetts, Minnesota, or Wisconsin, they have different standardized plans, which what I'm speaking of tonight does not cover those states. To be eligible, enrolled in Part A and Part B, be a resident of the state that you're in. Of course, age 65 plus, you can get it under 65 with certain disabilities. It will be extremely expensive. People of any age with end-stage renal disease. Now, as I talked about the plans being the same. A Plan G is a Plan G, same benefits. But if you look at the companies throughout the state A to Z, there could be $100 a month variance in those starting premiums. And there's some reasons for that, which we don't have time for here tonight. But anyway, we can cover that later if you have any questions. You do need to plan on these premiums increasing annually. They will do that. It will be an increasing cost for you. It is more of the Cadillac coverage, but the premiums will go up as you get older. So we've got an amazing medical plan right there, the best option you've ever had as far as doctor coverage and inexpensive out of pocket. Need to add prescription drug plan. That is the Part D. Now, these are offered again through private insurance companies. The government, CMS, Medicare has oversight over them. And coverages plan vary from plan to plan. The prescriptions can plan. The list of drugs can change. They don't have to offer every drug available. They basically have to have brand names and generics for a disease set list. And there's different tiers, copays, that type of thing. We'll talk about that right here. Just think of these companies. They list out and decide what drugs they're going to offer and pretty well just sort them from cheapest to the most expensive. They'll put them normally in a 1 to 5 tier situation, with the one being the preferred low cost generics down to number five being the specialty high cost drugs. Then they'll put copays, deductibles, that type of thing on those prescriptions. As far as what you pay, if a drug plan has a deductible, you would pay that first. If there after that is satisfied, then it would drop to your copays and co-insurance. In 2025, they've just changed where they're capping your out of pocket to $2,000 for covered drugs. Once you get to that $2,000, then it goes to zero for the rest of the year. And they call that catastrophic coverage. They probably need to change that name, but it does go to zero. 2025 also, there's a new payment option, payment plan that's available should you want to just spread that cost out over a number of months. Now, that pretty well is Medicare. Again, Medicare card is your cornerstone. Then you choose Medicare Advantage or Medicare Supplement with a prescription drug plan. Let's quickly cover TennCare or Medicaid. With this, TennCare and Medicaid, this is for individuals. As far as TennCare and Medicare that have Medicare, they normally would have a low income limit and limited resource. Anybody that fits those three categories, you should apply to TennCare for extra help. They will take you through the process. They will make a judgment and tell you if you qualify. If you qualify, there are definitely benefits. So anyone that thinks they're low income and limited resources, we'll get into more detail here in a second, I would urge you to go ahead and to apply. Now, the kind of to give you an idea of the levels here, if you look at that third column, income limit up to 100% is you would qualify for what's called QMB. With that, that $185 premium, Medicare premium gets paid. Basically, you have no deductibles, no co-insurance. Everything is zero copay for your medical coverages, lower cost prescriptions. The middle right there, 100 to 120 would get you to the SLMB. Again, pays the Part B premium. You would have prescription coverage at a lower cost also. Now, the fourth column there are some resource limits here. They do look at, what you have in the bank, different types of things there. So there's a two-piece qualification. But again, if you fit anything toward that, I would urge you to go ahead and apply. The other question I get a lot is nursing home. Does Medicare cover nursing home? They do not. But if you basically spend your money down till you get to certain levels, then you can qualify for institutional Medicaid, which would allow you to be able to get Medicaid, or I'm sorry, nursing home coverage. Now, in 2025, the Medicaid income cap is $2,901 per month. And then there is also resource limits, and that limit for an individual, the standard is $2,000. If it is two spouses, that individual spouse's resources can also be taken into account in that. Again, all that to say, I would encourage you to call them and apply if you even have a hint you might be able to apply. And that's the way you do it. You can either call for phone help or go to any DHS office, and there's the office locator number for that. So that gives you an idea of the Medicaid. Medicaid is or TennCare, whichever name you want to use. Very confusing. They know the rules, and it's best to call them. So, in this short time, I truly appreciate it. Let me guide you to my website should you want. On that website, a couple of pieces that might be of help to you. There is a full 45-minute recorded webinar called Making Medicare Simple. It basically expands on anything we talked about tonight. When, how to sign up for Medicare, more detail about the different types of plans, the special enrollment periods, all that. Also, there is a Tim Talks on there, and that's just simply 30 of the most frequently asked questions I've gotten and short 1 to 2 minute video answers on those questions. Of course, you see my phone number there. Again, I apologize for not being able to be there to answer your questions in person, but please, please, if you have any question on the Medicare, give me a call. I would be honored to serve you in answering those questions. I would again direct you to TennCare on the Medicaid side, as they are the experts, and I try to stay on the Medicare side. So, God's richest blessings. Again, I apologize for not being with you in person, but I hope you have a wonderful evening. Thanks again. Good night.